Hello friends, I am Dr. SACHIN MUTHA. Today we are going to study the classification of anti-Parkinsonism drugs. First of all, what is Parkinsonism? Parkinsonism is a disorder of the CNS system, mainly caused due to the drugs, toxin, injuries in the brain. What are the signs and symptoms of Parkinsonism? The main sign and symptom of Parkinsonism is tremor, muscle stiffness even when the muscles are relaxed, disability or inability to walk, talk or bend. It mostly affects the locomotory system and so the movements are affected. Now, in normal human being, there is a neurotransmitter that is dopamine and acetylcholine which is present in the body but in the normal equilibrium level. But in Parkinsonism, there is a reduction in the dopamine and increase in the acetylcholine. And so the classification goes according to it. The drugs which are affected according to the dopaminic system and the drugs which are affecting the cholinergic system. So now let's start the drugs which are affecting the dopaminergic system. For that I have prepared the mnemonic Do Do Gut Komat Pani. For the first do, that is a dopamine precursor, the example is levodopa. Then for the second do, that is dopamine agonist, the example is bromocriptine and ropinirole. Then do do gut, that is the glutamate NMDA agonist receptor, and here the example is amantadine. Always try to memorize that in Parkinsonism there is a glutamate NMDA agonist facilitator receptor, and in cognitive enhancer, that is a cerebroactive, there it is also NMDA glutamate, but there is NMDA glutamate antagonist and the example is memantine. Then do do gut co for CO, that is the COMT inhibitors, and the example is tolcapone or entacapone. Then do do gut co mat for mat M, that is the MAO-B inhibitors, and here the example is selegiline or rasagiline. Also, MAO inhibitors are of two types, A and B. A, it is present in antidepressant type, that is the antidepressant drugs classification type, and the example there it is your moclobemide and chlorgyline. But in Parkinsonism, for the MAO-B inhibitor, the example is selegiline and rasagiline. Then do do gut co mat and pani for P, that is the peripheral decarboxylase inhibitor, and the example is carbidopa. Now the drugs which are acting on the cholinergic system, and it is also divided into two types, central anticholinergic drugs and the antihistaminic. For the central anticholinergic drug, the example is trihexyphenidyl, then your procyclidine and piperidine. And in antihistaminic, the example is the very famous promethazine and orphanadrine. I have prepared this mnemonic so that each and everyone, the practicing doctors, can understand the Parkinsonism and the anti-Parkinsonism drugs in a very simple manner, because it is a very complicated and the drugs, the names are very, it is not so easy to remember. So I have prepared this mnemonic. Hope you like this. For more classification, please like and subscribe my channel. Thank you.